The gentleman from Tennessee is recognized for 5 minutes.
I thank the gentleman for yielding. Mr. Speaker, I rise today in support of H.R. 2, the repeal of Obamacare. For the past 30 years, I haven't been a politician, but a physician treating patients and delivering babies in rural East Tennessee. And I can say without hesitation, we have the finest health care system in the world. Health care should not be a partisan issue, and I personally have never operated on a Democrat or Republican cancer in my life. You can't spend $1 trillion and have a bill that's over 2,500 pages long and not have something good come out of it. This bill is not, however, good medicine for our country. The repeal of Obamacare doesn't mean that we aren't for health care reform. Quite the contrary. What I discovered in my own practice in 30 years, was health care was becoming more and more unaffordable for our citizens. And we had a group of patients, a group of citizens who didn't have affordable health insurance coverage. This we need to address. This bill does increase the number of people who have insurance, but does nothing to control the costs. The other side says that if we repeal Obamacare, it'll increase the costs and decrease access. Well, let's take a look. Decrease costs. Let's take a look at 3 government-run plans. One is TennCare, my state's Medicaid program, the Massachusetts Care, and Medicare. In TennCare, we had a plan that had competing interests to compete for your business. It was supposed to hold costs down. We saw our costs in Tennessee from 1993 until 2004 and 5 go from $2.6 billion to $8 billion. It tripled. And what we found was that half the people who went on the government plan had private health insurance and dropped it and got on the government plan. This plan took up almost every new dollar our state took in. We balanced this on the backs of college students. We have less highway patrolmen in our state than we had 30 years ago, and we've got 2 million more people. What our governor, Democratic governor, did was ration care by cutting the rolls of TennCare patients and also limiting the access to physicians to 8 visits per year. Let's look at Massachusetts Care, where there's a mandate right now. You are required to buy a good or service, and the government decides what the right good or service is, not you as a consumer. And so what happens is it hasn't helped the cost down there either. Costs, they have the highest private insurance premiums in America in Massachusetts. Emergency room visits are not down. And why is that? The same as TennCare. These plans don't pay for the cost of the care, shifting more costs over to the private sector, making it more and more expensive. The second thing this mandate does, it empowers lobbyists. And how it does that is that you'll see the lobbyists come to us, the politicians, and say, hey, we want this medicine or this device on our plan. And these are the people that write the checks to the politicians. So you're empowering them. And let's finally look at Medicare, a program that started in 1965 as a $3 billion program. The government estimators at that time said in 25 years this will be a $15 billion program. It was over a $100 billion program. Today, over $400 billion. So we have 3 examples where costs are out of control in the government-run plans. The senior citizens understand this. When you take $500 billion out of a plan, and in the next 10 years we're going to add 36 million seniors, 3 things are going to happen when you've got more patients chasing fewer dollars. You'll have decreased access, you'll have decreased quality, and you'll have increased costs. That's a given. So we have had the President say last year that I will go over this bill line by line. I've read this bill. I wanted to go over it. I wanted to have meaningful health care reform, but was denied that privilege. Without exception, our states are almost broke, every one of them. And we're adding another unfunded federal mandate to require them to pay and implement a plan that's already breaking them, the expansion of Medicaid, which is an entitlement. Businesses get it also. If this is such a great plan, why have to date 222 businesses opted out, including McDonald's, and of all people, the SEIU, the Government Employees Union, who fought for this and then opted themselves out. I find that ridiculous when you see that. The doctors get it. The doctor fix, the SGR fix is not in this bill, a cost that was hidden. And as doctors are squeezed, they cannot see patients that cannot pay the cost of the care. Malpractice is not in this bill, and I can tell you as an OBGYN doctor, it's over the top. It's almost unaffordable for us there. So the American people get it, the people of Tennessee get it, And we as elected representatives get it. We got that in the election of November 2nd. I would encourage my colleagues to vote to repeal Obamacare, and I urge my colleagues to do this, and I yield back the balance of my time.
Gentleman yields back. Gentleman from California.